I'm going to talk about partnering with the NHS in England and share some of my perspectives on challenges and opportunities. Just before I do, I'd really love to know who you are. Not going to ask you all to introduce yourselves one by one, but are you from digital health companies? How many digital health companies? Okay, couple. Life sciences, people, yeah, okay. Advisors, investors, yeah, academics. Oh, great. Okay. So a good mixture then. I'm keen to have an interactive session. So there's a microphone at the back. So if you have any questions, then just pop your hand up and we can have a discussion as we go along. So what I wanted to do today was talk about some of the challenges facing digital health companies that are looking to sell to the NHS, and maybe offer some advice on how best to maximise chances of success. So I'll talk about the usual routes to market for innovative companies in England and the pros and cons with each, a little bit of advice, and then I've also got a couple of case studies to share with you as well. So I'm from Hollywood originally, and now I live in London, and I've worked in and around the English health ecosystem for more than 15 years. I've worked for national bodies working on lots of hospital mergers and studies and investigations, and I spent some time working with the executive team at the Royal Free in London. And as I said, I help innovative companies that want to partner with the NHS. I run a trade association called the Digital Healthcare Council, which is a network for digital-first health and care companies. I run a network for senior women in health, and I host the Women in Health Tech Show podcast. We do the podcast in seasons of 10 episodes, and I am looking for some guests for the 5th season, which we're just starting to record. So if you are a woman working in health tech or someone who supports women working in health tech, do please get in touch. We can have a conversation about that. I'm also on the board of a policy think tank called Reform, not the political party. Hasten to point that out. And as I said, I'm from Hollywood, but now based in London. And if you have any questions, do drop me an email or connect with me on LinkedIn. So in terms of the challenges that we're currently seeing in England, I'm sure these will be very familiar to the challenges that many of you see here in Northern Ireland. The system is often reorganised. It has been reorganised very recently with the creation of 42 integrated care systems, and it's still really in flux. So that means if you're trying to get a handle on where in the system to have commercial discussions with, it can be very difficult because there's quite a lot of churn, people come and go. There are lots of opportunities in the sense that there are lots of organisations that innovative companies can potentially partner with. So we have around 220 NHS trusts in England and around 7,000 GP practices. Contracting is very slow and complex. I suspect that that's the same everywhere in publicly funded healthcare systems. So I've seen some of my clients, some companies can get traction in the system in 6 months, but that's very, very fast. And that was during COVID, and I'll talk a little bit about that later. A sort of 12-month period of time to be able to get something up and running is probably a bit more normal. There are funding pressures in the system, that won't be a surprise to anybody, and also demand pressures, and the industrial action in England recently has definitely made some of those demand pressures even more difficult. And I would also say there's quite limited bandwidth. I'm sure you see that here as well. The workforce is generally quite tired and overworked. So asking people to think about doing things differently, using technology to work in new ways can certainly be quite challenging. In terms of the opportunity and the context, so the NHS is definitely open for innovation. And we are seeing change starting to happen. When I speak to senior contacts in the NHS, they're telling me that they are starting to see digital and innovation as definitely part of the solution to the challenges that the system faces. So although it is very slow, it is definitely starting to move in a new direction, which I think is really interesting. And tech solutions are definitely needed, given the backlog and increasing demand and workforce pressures. We're seeing funding being made available for certain types of innovation. And, you know, if you have an innovation that helps with one of these challenges, then in a sense you are able to push at an open door rather than try and make a case for, solution in a different area. So NHS England recently published its operational and planning guidance for the year, and it said that it wanted to focus on elective recovery, technology in primary care, further rollout of virtual wards, as well as using tech for improving mental health access and community care, and that bit of the system where you have step-down services from acute into the community. And there is funding to support technologies in these areas. So if that's an area that you're interested in, then do have a think about whether you can potentially expand into the English market. I think the pandemic really changed the way that the public interacts with the NHS. And so the vast majority of GPs now offer video consultations or telephone consultations, which is, I think, quite an interesting change. That was only 3% before COVID. And so during the pandemic, new technologies, treatments and working practices, which might have taken months and even years before, were fast-tracked in a matter of weeks. I would say that I think we've moved back from COVID times in terms of deploying innovation. The NHS has said it's coming up with systems and processes to speed up the implementation of technology, which always kind of strikes fear into my heart whenever the NHS comes up with systems and processes to try and make things work faster. Sometimes that plan doesn't always pan out the way people are hoping. Interestingly, the Shadow Health team, so the Labour Party, is talking about creating an NHS fit for the future, and they see an opportunity around new technologies to help people to access care and to help people working in the system to be able to treat people faster and to predict and prevent illness. So I think if we see a change in government in the short term, we won't necessarily see a move away from technology. So I think that kind of context is helpful as well. So I suppose if you're an innovative company looking to partner with the NHS, I would say that there are three main ways of working with the NHS, just to go through each of these in turn. So the first way is a pilot, and a pilot is generally a sort of often centrally funded early stage experiment involving new services of some kind. And we saw quite a lot of pilots in England whenever virtual wards were first being rolled out to enable people to access often community care remotely or to be discharged from hospital more quickly. Pilots generally last around 6 to 12 months, and they're usually done in partnership with an NHS provider. So the virtual wards pilots were done in partnerships with NHS trusts. You sometimes see them advertised as a contract opportunity or shared within a sort of innovation network in a particular area. So if you're looking to get started and you have some tech that's ready to go, a pilot can be a good option, but there are some things to look out for. You might end up just doing lots and lots of pilots and not actually getting any contracts at the end of it. So you can invest a lot of time and energy as an innovative company in getting a pilot set up, but then it doesn't necessarily lead to a commercial contract at the end. So we advise people to be really clear on the purpose of the pilot and how success is going to be measured, so you're able to show whether or not the pilot has actually had an impact and help build a business case for a longer term deployment of the technology. And also consider what will happen after the pilot. So if you hit certain metrics, can you then bid for funding and be able to roll it out over a longer period of time? We sometimes see where innovative companies are relying on another NHS organisation doing something or needing to integrate the technology into existing care pathways. If you have a 6-month pilot, it can take 5 months to get that organised. Then you only leave yourself with a few weeks to actually do your pilot. So that's not a good idea. We're seeing some companies in the trade association that I run taking quite an innovative approach to funding. So instead of running a pilot, we have one member that says they don't want to do pilots, it's a complete waste of time, and they have a funding pot where they will match funding that is contributed by an organisation in order to try their technology. So their investors set aside an amount of money. And so essentially you're offering a 50% discount in order to run a service to see if it works, usually over a period of 12 months. So if that's something that you're thinking about, then that kind of innovative funding model, I think, can be quite helpful. So has anyone in the room run a pilot project with the NHS? Yeah, oh, you have. So would you share your experience of that with us? I'd be interested to hear, how did it come about and how did it work out?
Yeah, sorry, my name is Richard Brady. I'm a robotic surgeon from Newcastle upon Tyne, not Newcastle, County Down, but I work with the University of Ulster. And some of the work that we've done is on medtech devices, particularly wearables, and where companies are coming up to that point where they want to get on to regional procurement. So they'll, if they have a new device that's had a CE mark, they will then come up to the trust and say, look, would you run the pilot? And, you know, traditionally it's in 50 patients over long term for that kind of research. We have run RCTs or done earlier work in terms of bench to bedside work, but the pilots are a real business opportunity for trusts. Commercial research brings in substantial income and allows you to supplement your own nursing staff and research nursing staff and infrastructure.
Yeah, great, thanks so much. And sometimes when we see a market maturing, it's like you said, you see lots of pilots to start off with to really develop a good value proposition to form those relationships. And then when the market starts to mature, then you see procurement opportunities in that space. So yeah, thank you, that's really interesting. So partnerships is the other way that I see innovators getting traction in the NHS. And by partnerships, what I mean is projects testing combinations of digital technologies with pathway redesign in real-world settings. And normally they would be co-designed and co-delivered with an NHS organisation. So the tech it's in development or it doesn't quite exist to be used in that context at the beginning. And you would work with an NHS organisation to develop the technology. Sometimes NHS organisations actually take ownership of the IP or some share in the company itself, so that there's some commercial upside to the organisation. And I think a lot of NHS organisations are getting a bit savvier about those commercial conversations. So one good example that I came across is a project called Little Hearts at Home. And this was run by Alderhay Innovation Hub, a children's hospital in Liverpool, where they wanted to be able to discharge premature babies to send them home as quickly as possible. So they worked with a software company to develop a virtual monitoring platform for preemie babies, and it worked really well. And now Alderhay is looking to scale that across England and also internationally, because the IP of that project sat with Alderhay. So I think that's a really interesting example. I also wanted to talk about the smoke-free pregnancy programme. So this was a partnership project that was run with a team of midwives out of Greater Manchester who wanted to reduce the incidence of pregnant women smoking during pregnancy. And they partnered with a company that was able to build a platform for them where they could give vouchers to women to encourage them to stop smoking, and they could test things like carbon monoxide in the blood of pregnant women to encourage them to see the difference when they stop smoking. So that smoke-free pregnancy was a great success, and I think there's recently been a national procurement opportunity to roll that out more widely, but that started as a partnership project at the beginning. So a partnership can work well if you're up and running and you're looking to scale, but you're willing to develop your technology in different ways in partnership with others. And the things to watch out for there are who are the key stakeholders and what do they actually need to do. And if it's a funded partnership, actually having that deployment plan at the beginning of the kind of partnership conversation can be a really good way. If you get that all done up front, then you can kind of hit the ground running. Being clear about what's in and out of scope and what would have happened had the partnership not carried on can be useful for building the business case, and then thinking about evaluation and the data that you need to use to evaluate what's happening. Has anyone here done a sort of partnership model in and around the system? Is that something that exists here that you've seen? No? Okay. And then the third way for innovative companies to work with the NHS is a procurement exercise. So these are generally for established companies with a track record of working with the NHS, and you respond to a procurement opportunity. I'm sure you've all seen those and probably participated in those. It's interesting, the virtual ward sort of experiments that we saw in England have now moved into the procurement phase, and those opportunities tend to be put out for tender. Sometimes they're centrally funded, for example, for the first year, but that can create some challenges as well, because with a lot of these technologies, to really get traction over the medium term, you need to really see cultural change and change in the way people work, and a year often just isn't really long enough to actually get that done. So where you have funding pots just for a year, things tend to start and then stop again. So to really be able to get technology into the system and moving at scale, you often need much longer than a year to actually get something up and running. So trying to get ahead of those funding conversations earlier can be quite important. If you're a well-established company and looking to scale, then responding to tenders can obviously be a good strategy. I wanted to mention a company called Preventex. So they are a remote sexual health testing company. They started off doing very small localized services in relation to chlamydia testing. And then they partnered with a number of NHS organisations to provide a sexual health service across London, which required lots of different organisations to come together to do that. And they recently won a national contract to try and test people for hepatitis C with a view to eliminating hepatitis C. So they're also expanding into the US market now as well, and have some interesting observations on how that's gone. But I think that's quite a good example of starting small and working with others in partnership across a region like London, and then bidding for national contracts. So if you are bidding for a national contract, what do you need to look out for? You might have a central initiative, but you still need a local need and relationships. So I've seen some companies come unstuck where they've won a place on a national framework agreement, but then locally people didn't really want to prioritise that particular service, even when it was funded. So you need to be able to have those relationships on the ground. And then also, do local organisations know about the opportunity, and are their priorities the same as national ones? And can you work with local teams to submit funding requests for national programmes? Being able to request funding in partnership with NHS organisations can be a good way of working together. So has anyone successfully responded to tender opportunity? No? Okay. So a few of you said that you were innovative companies thinking of partnering with the NHS. So if you are one of those companies, which sort of approach do you think would work best for you? And why do you think that is? Who can share some thoughts with us? Thank you. We'll just get the mic over to you. If you just say who you are and where you're from.
Hi, I'm Akshay Kumar Kamble. I'm a consultant neuroradiologist in Coventry. And my innovation is about detecting brain cancer genotype before biopsy using MRI scans. So I think pilot sounds interesting, and I think what you have said about you need to think about how you will translate that into real practice with help of business plan. So you need to have right objectives. So that's really interesting. I was thinking SBRI grants, something like that. I don't know whether that fits the pilot criteria, but that would be a good approach.
Yeah, definitely. Yeah, using grant funding to be able to get a pilot up and running can work really well. Some companies decide to fund pilots themselves, but I think increasingly companies are looking for funding to be able to financially support a pilot. Yeah, great.
Thank you.
Thanks. Anybody else? Yes, there's one here.
So how do you submit pilot application or partnership application?
Yeah. So often there's no particular pro forma way of doing it. You need to connect with a bit of the system where you think has a problem that you can help with through your pilot, and then have a conversation with clinicians and others within local NHS organisations to see if they would be interested. And we can talk a little bit more about how to do that in a minute, because I think that's quite an important part of the puzzle. But the actual there's not really an application, it's simply a commercial approach. Was there another example here? Yeah.
Hi. Yes, in England you have the Health Innovation Networks, previously IHSNs. Have you had experience of working with them, and is that a good way to enter into working with the NHS for innovation?
Yeah, so so the AHSNs, for those who don't know, they were originally set up to kind of bridge academia, practice, and innovation, and now they've been rebranded. It's like everything is always called something else after it's had one name for a couple of years, but they're now Health Innovation Networks. Yeah. So yes, they are often good. They can be quite variable, and a lot, I think, depends on their relationships with local institutions to be able to actually influence the ability of those NHS organisations to take the companies that they're working with and actually do something together. Some of them run quite sophisticated programmes. So the one I'm most familiar with is one based in it was the original Health Innovation Network. It's the South London Academic Health Science Network, and they run accelerator programmes for early stage companies. And they work quite hard to connect those companies with staff in NHS organisations in South London. So they can be quite helpful. Part of the challenge they have is that they don't always have funding to be able to actually fund contracts, so they can fund their own work, but you still need to figure out where the funding is going to come from and who would be willing to fund it. But if you're trying to make connections in a particular part of England, then the HINs can be a good mechanism for getting into the system. When you're figuring out where to do your pilot project or where your partnership efforts might be best focused, really step one is thinking about who is your customer and what's the problem that you're solving and how this helps the NHS as a system. A lot of companies are fantastic when they're talking about their tech and how their tech can do all these amazing things, but really figuring out which problem you're solving, which big problem you're solving, and how you solve that problem is a super important first step. It kind of sounds obvious, but often people neglect to do it. And then asking if the NHS is worried about this problem too. So I gave the examples of the extracts from the planning and operational guidance about elective recovery and tech and primary care and so on. If the NHS is worried about that problem too, then you're going to make life easier for yourself. And then obviously thinking about who is the user. Is the user of the product a service user, a patient or an individual, or is it a member of staff, for example? And then thinking about who the purchaser is and how you can actually reach that purchaser. Just taking time to work through these simple steps can save yourself a lot of time further down the line. So this case study I just wanted to share, it was quite an interesting one. So this was an innovative company with a vaccine shift scheduling platform, easy for me to say, that wanted to establish some commercial contracts with NHS partners in primary care. And it managed to find its first NHS customer within 6 weeks, which is sort of record speed. I've never come across that before or since. And that was really interesting because they did have a really specific solution to a very specific problem. But when I was saying before about finding your customer and working out what the problem is, if you can do that, you can make life much more straightforward. So this company developed a strategy for finding NHS partners, starting with primary care networks. These are groups of GP practices that we have in England. And they just went through these steps. They did demos of their technology to introduce them and endorse their technology. They worked on their positioning with the NHS in terms of articulating how they solved the problem. In this case, it was making sure they had enough people to actually give COVID vaccines and to schedule the shifts that those people would do in order to deliver the vaccines. Their NHS contacts spoke to each other once they'd got up and running in one area, and that then made it easier for them to find other NHS contacts. And when I speak to my NHS contacts and say, if you're interested in finding innovation in a particular area, like where do you start? Do you have a list of innovative companies or a directory, or how does it work? And often people say they will approach other people they know in the NHS to ask them what they're doing and then use those companies as the first place to go. So getting that positive feedback can be really useful. They did a short-term pilot with appropriate metrics, and then that then led to commercial opportunities. And they also increased awareness with key individuals around the ecosystem to increase reach and potential impact. So they did well, and then the founders of that business then exited that business. They sold it to a larger company, and they're off doing something else now. So that was quite a specific COVID opportunity, but I think as a commercial strategy, that was interesting. They saw a need, they acted really quickly. They did their pilots, they had a plan for what would happen after the pilots. They then secured commercial opportunities, and then they went off to do something else. The second case study is this remote sexual health testing service that I mentioned before. And again, that was, as I said, I won't go through it all again, but that was quite a thoughtful strategy of local opportunities, then regional opportunities, then a national opportunity, and also expanding internationally. So in terms of sort of how to win, like if you are in this space trying to play this, like how do you actually win? So I think that you need to be aware that speaking to colleagues is a key part of the due diligence that potential purchasers do. They will go to conferences, they will read journals to see published research about how technologies are helping, and they get approaches from suppliers. So someone I was talking to last week said they got about 500 cold emails every week from companies offering some type of innovative solution. So it's very difficult for organisations to engage with that volume of contracts. So you need to find other ways to kind of cut through the noise. I think a really useful strategy can be attracting potential NHS partners to you. So on your pilot example, at an early stage, I would say, do some market discovery where you connect with people who are speaking at conferences, who are on LinkedIn talking about the problems that they have, and just do some research to understand whether they would be willing to try the innovation that you have. And talking about your work, you know, again, on LinkedIn, we see that being very effective. Also at conferences can really help for people to hear about you. Whenever I approach NHS partners on behalf of innovative companies, I'm often asked whether the companies have a clinical reference group. So having clinicians involved with advising your company, whether as a separate sort of clinical reference group or as part of an advisory board, can be quite persuasive as well. People want to know that you're credible and that you can be trusted, and having some clinicians working with you, I think, can be very compelling. And also think about how to offer value to all the different stakeholders that you need to work with. So we had a company that community nurses really loved their technology, and that worked really well. But then the IT team of the organisation involved was very focused on an electronic patient record deployment, and what the community nurses wanted wasn't such a priority to the IT team. So this particular project ended up stalling because although the community nurses liked it, the IT team weren't on board, so it just stopped. So really thinking about how you can help all of those different stakeholders to prioritise your work is really important. Prioritising partnership working really is useful as well, working with different organisations to co-produce and to talk about how you're adding value to their system is very useful. And then the other interesting thing is, you know, we know what all of the challenges are right in the health system at the moment, as well as many of the solutions. I think the main challenge is actually around implementation and deployment. And if you can get really good at implementation and deployment, I think that that could be really useful. And so a strategy that a lot of organisations are using is to land locally, expand to neighbouring organisations, and then bid for larger contracts. And I would say to play the long game, it's not easy, but it's definitely worth it. We have a mini course that we've designed about connecting with the NHS, so how to run virtual workshops. That can be a really good way of bringing people on board. So if you're interested, do take a look at that. Well, I'll send around my slides after so you can look a bit more at some of the links that I've posted there. So that's all I was going to say. Hopefully you'll find that helpful. If you want to speak to me about partnering with the NHS in England, just get in touch. I'm happy to chat to you.